Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. The term gravidity is something we use to describe the number of pregnancies that a woman has had, regardless of the outcome. So what that means is the pregnancy is the only thing that matters. It doesn't matter if she delivered term, if she delivered preterm, if she had an abortion, if she had termination, anything however the pregnancy ended is not important. It just matters the pregnancy happened. So within this, we have some more terminology depending on the number of pregnancies a woman has had. So if a woman has never been pregnant, she's considered a Nulligravida. Null is 0. If a woman has had one pregnancy, or she's currently pregnant, she is considered a primigravida. Prima is 1. If a woman has had more than one pregnancy, she is considered a multigravida. She's been pregnant multiple times. So she's had more than 1, 2, 3, 4, whatever. Parity is the term that we use to describe deliveries, and these are deliveries that happened after 20 weeks gestation. The reason this matters is because 20 weeks is considered the age of viability for this purpose. Any deliveries that happen prior to 20 weeks gestation are considered abortions, regardless if it was a miscarriage or if it was a termination. Okay, so parity is only looking at deliveries that happened after 20 weeks. If she has not delivered a pregnancy past 20 weeks, she's considered a Nullipara. Okay. If she has had one pregnancy that delivered past 20 weeks gestation, she's a primipara. If she's had more than one delivery that has been after 20 weeks gestation, she's considered a multipara. She's had multiple deliveries, so more than one. Also important to know that if she had a multiple gestation pregnancy like twins or triplets, that delivery still counts as one delivery under parity. So when we look at gravidity and parity, this is helpful to know how many pregnancies and how many deliveries that we've had. But in order to really understand the full obstetric history of a woman, we need to break it down further. So that's where GTPAL comes in. So we're going to look first at the G is gravida, the number of pregnancies. This stays the same. But the rest of it is going to fall under the umbrella of parity. Okay. So when we look at this umbrella of parity, we're going to look at how many term deliveries has she had. Term deliveries are going to be any deliveries that happened after 37 weeks gestation. How many preterm deliveries has she had? Preterm deliveries are going to be from 20 weeks up to 36 weeks and 6 days. So these two make up our parity. But in this umbrella, we're also going to consider the other parts of her obstetric history. So how many abortions has she had? And this can be spontaneous abortions, like a miscarriage. This can be a termination. Any pregnancy that ends less than 20 weeks is called an abortion. And then we also look at how many children she has currently living. And this is what makes up our GTPAL. Now, when you see this written out, most often you'll see it written a couple different ways. You'll either see it this way. So here we have G4, T2, P1, A1, L3. This means that this is a patient who's had 4 pregnancies, 2 term deliveries, 1 preterm delivery, 1 abortion, and has 3 living children currently. We may also see it written this way. And when it's written this way, the G stands for gravida, and this P stands for parity, not for preterm. Okay, this is parity. This is our umbrella. So this is the same as this. This is 4th pregnancy, 2 term, 1 preterm, 1 abortion, and 1 living. So when you see it written this way, then in your head, think GTPAL. She's a Gravida 4, Para 2113. All right. So now let's practice. A client on postpartum just delivered a son at 37 weeks. She has a daughter at home that was born at 28 weeks and a son that was born at 38 weeks. What is her GTPAL? So she just delivered a son at 37 weeks. So that's 1 pregnancy. She has a daughter at home that was born at 28 weeks. So that's a 2nd pregnancy. And then she has a son that was born at 38 weeks. So that's a 3rd pregnancy. So for G, her Gravida is 3. How many of her deliveries were term? So when we think about term, we're thinking about greater than 37 weeks. So 37 weeks and above. So the baby she just delivered at 37 weeks is term. The baby that she delivered at 28 weeks is preterm because it's less than 37 weeks. And then the son that was born at 38 weeks is also term. So she has 2 term deliveries. For preterm, the child that was born at 28 weeks is her preterm delivery because we already determined that the 37-week and the 38-week were term. So she has 1 preterm. And now has she had any abortions? And she has not. So her A is 0. And then for living children, she has the son she just delivered, the daughter at home, and the other son that was born previously. So she has 3 living children. And that is her GTPAL. Next scenario. Pregnant multipara has a son who was born at 35 weeks, a set of identical daughters who were born at 36 weeks. The client also delivered a stillborn 2 years ago at 38 weeks and had a spontaneous abortion 7 months ago. What is her GTPAL? So in the very beginning of the scenario, we can see that she is a multipara. So she's had multiple deliveries after 20 weeks. Okay, so we know that she is a multigravida multipara. So when we think about how many pregnancies she's had, it says she's pregnant. A pregnant multipara has a son who was born. So that's 1 pregnancy. She's pregnant currently. Okay. She has a son that was born at 35 weeks. So that's a 2nd pregnancy. She has a set of identical daughters who were born at 36 weeks. So that's twins. It counts as 1 pregnancy. Okay. The client delivered a stillborn 2 years ago at 38 weeks. That's a pregnancy. And had a spontaneous abortion 7 months ago. That's a pregnancy. So her total pregnancies or her total gravida is 5. Okay. I didn't mean to raise my hand. Cannot make it go down. Her term deliveries. When we think about her term deliveries, she has the son that was born at 35 weeks. That's less than 37 weeks. So this one is not term. The twins were born at 36 weeks, also not term. She had the stillborn that was born at 38 weeks. That's greater than 37 weeks, so that's 1 term. And then she had a spontaneous abortion 7 months ago. So that's not term. So she has 1 term delivery. For preterm, she has the son that was born at 35 weeks. That's 1 preterm. She has the twins that were born at 36 weeks. That's going to count as 1 delivery. Okay, so that's 2 preterm deliveries. And then the stillborn was her term delivery, and the abortion doesn't count in preterm. So she has 2 preterm deliveries. And then she had the spontaneous abortion 7 months ago, so that's 1 abortion. And then under living children, this is where we're going to pick up that twin. So we didn't count the twin in the pregnancy and we didn't count the twin in the delivery. We're going to count the twin in the living children. So she has the son that was born at 35 weeks. She's got the twins, 1, 2. Then the baby that was stillborn is not going to count under living, and then the spontaneous abortion is not going to count under living. So living children, she has 3. Next, multigravida delivered a daughter at 28 weeks and had 2 spontaneous abortions at 12 weeks and 14 weeks. Is the client a primipara, and what is her GTPAL? So we already know it says a multigravida, so we know that her G is more than 1. Okay, she had a daughter at 28 weeks. She had a spontaneous abortion at 12 weeks, and she had a spontaneous abortion at 14 weeks. So her gravida is 3. Now it wants to know, is she a primipara? We know she's a multigravida. But remember, a primipara means that she has only completed 1 pregnancy past 20 weeks gestation. So when we look back at the scenario, she has the daughter that she delivered at 28 weeks. And then she had a spontaneous abortion at 12 weeks and she had a spontaneous abortion at 14 weeks. So she really has only completed 1 pregnancy past 20 weeks gestation. So she is indeed a primipara. Okay. She has only completed 1 pregnancy past 20 weeks, although she's had multiple pregnancies. So she is considered a multigravida primipara. So her gravida is 3. For term deliveries, the delivery that she had was a daughter that was 28 weeks. So that's less than 37 weeks. So that's a 0. This is a preterm delivery at 28 weeks. So under preterm, we get 1. Under abortions, she's had the spontaneous abortion at 12 weeks and the spontaneous abortion at 14 weeks. So she's had 2 abortions, and then she has 1 living child. Okay, so hopefully this makes sense. When you're thinking about the GTPAL, think about it being part of the umbrella. She's a gravida for para 3, but if we look at the whole scenario, we can see term, preterm, abortions, living. And then if we're breaking it down like that, then remember that this P means para, and the rest of these numbers are the rest of your GTPAL. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.